I'd like to welcome everyone to the 10th Annual Nathaniel Lichfield Lecture. These lectures were made possible by the generous endowment from Nathaniel Lichfield's widow, Dalia Lichfield. And I had the pleasure of meeting Dalia at last year's Nathaniel Lichfield Lecture, and I know how much she and colleagues across the profession enjoy these very special lectures. And probably the best evidence of that, this is our first year of doing it in a virtual format, and we have already got signed on nearly 400 people in the audience. And if that isn't testimony to the lectures and to the interest across the profession, I don't know what is. So this year, the 2020 Nathaniel Lichfield Lecture focuses on health and well-being. There is no doubt that the quality of our places and spaces affects our health and well-being. Indeed, if there's been one positive from our experiences of the COVID pandemic, then it's been to reinforce this relationship, reconnecting the profession with its roots in the early 20th century. Our built environment impacts on health and well-being in limitless ways, from the homes that we live in through to the planning of our spaces and places. Healthy places can support our cognitive, psychological and physical development, promote social interaction and affect how we function, especially in our earlier and later years. The impact of unhealthy environments is not spread evenly across society. Less affluent people tend to die younger than more affluent people. Poor people are also more likely to live in neighbourhoods which are worse for health, with poorly maintained homes and public spaces, poor access to services and higher exposure to noise and air pollution. As the former RTPI president Janet Askew noted, health problems such as obesity, chronic heart disease, stress and mental health issues are intrinsically linked to the physical environments in which people live and work. In essence, a poor quality built environment and poor quality places can have a significant negative impact on health, well-being, prosperity and happiness, whilst the converse is equally true. Many healthy design measures are features of good design, which not only benefit people's health and well-being, but also create better places with higher commercial value and lower environmental impact. It makes sense all round. Planning is for and about people, the places they live in and the spaces that they use. And to quote from the Building Better, Building Beautiful Commission report, Living with Beauty, published earlier this year, caring about people means caring about place. And as up to 40% of our personal health outcomes are a function of where we live, not who we are. So I'm therefore delighted that the 2020 Nathaniel Lichfield Lecture focuses on health and placemaking, and there is no one better placed to talk about this than Professor Georgia Watson. Georgia is a Professor of Urban Design in the School of Built Environment at Oxford Brookes University. She's also an academician and regional coordinator of the Academy of Urbanism and a Fellow of the Royal Society of Arts. Her professional background and academic training come from a history of art, planning and urban design. Professor Watson has extensive teaching and research and consultancy experience in urban planning and urban design. Her key research and consultancy projects include work on sustainable, resilient and healthy cities, placemaking, urban regeneration, community development, planning and design of new towns, place identity, and perceptual and cognitive experiences of places with different age groups, including elderly residents and young people. She's also been research advisor and consultant to various bodies at national and local government levels, providing expertise on planning and urban design matters. And in today's Nathaniel Lichfield Lecture, Georgia will be discussing how planners, urban holistic partnership working across different professional groups. She will be sharing thoughts on the roles of urban professionals in delivering healthy places. Now, I'm sure that, like me, you will be absolutely by what Georgia has to say. And if you have any questions that you would like to pose to Georgia as a result of what she's presenting, then please type them into the question box and we'll do our best to get through as many of them as we can. So with that, can I now hand over to Professor Georgia Watson. Georgia, it's yours.
Thank you, Sue, for this really very informative and interesting introduction. I am both challenged, but also curious about the current thinking about a healthy placemaking, because we have been engaged in so many different activities online, through web information, etc. And quite a lot of work that I will be talking about comes from pre-pandemic period, but also some of the workshops that I have been engaged in during the summer and also over the autumn period. The image in front of us is very interesting because it comes from a workshop of the American Planning Association, whereby they were trying to think how New York can be changed in 10 years' time, where traffic is calmed down, where widened pavements can provide support for children to play, residents can walk and talk and also socialize. And there are many initiatives throughout the world that have taken the care of how we respond to health and placemaking. From Canada, 8 to 80-year-old team who were involved in researching about how healthy and good places can impact on our health. The structure of my talk today is really to start with some of the examples where planners, particularly, who have been so influential in shaping the world around us, have developed different strategies, policies, how to deal with health and placemaking. The second part will focus on some of the findings from the Healthy Newtown program that I have been involved in as process evaluator, and will focus on built environment aspects, seeing how some of the new communities and teams are developing new agenda. And at the end, propose some common principles that link together both health and placemaking. So when we are trying to understand what is a healthy placemaking, it is very interesting to focus on the definition coming from the World Health Organization. And it says that it's a place or context in which we engage in daily activities and we can benefit from environmental, organizational, and other factors that affect our health and well-being. There are further definitions in terms of that, in terms of how we can benefit in terms of defining health in more detail. So again, World Health Organization, who have been running also a number of seminars during the summer, are talking also about that health is a state of complete physical, mental, and social well-being, but that globally and locally, we need to address some common issues: obesity, type 2 diabetes, hypertension, respiratory problems, but also social isolation and health-related issues linked to pollution, lack of exercise, and various other problems. And generally, we need to improve mental well-being and need to reduce stresses. But also more recently, through the International Council for Caring Communities, there have been many ideas about how we have been dealing with pandemic, but also how we can deal in future. So we all know, and our current president of the Royal Town Planning Institute, Sue Mans, identified, is that good quality built environment and natural environment have many positive impacts on our cognitive, emotional, social, physical, and mental well-being. We all know that we also get psychological benefits if we are in a pleasant, green environment rather than polluted cities and neighborhoods. It can also help us to develop self-awareness, self-esteem, and particularly spatial awareness. Now, we're all familiar with the work of Karen Lynch and others who talked about legibility and how it's important in terms of navigating through our streets, cities, and neighborhoods. But as we age, this spatial awareness weakens, and if we are living longer, we need to, as designers and planners, to focus on cities to strengthen the interpretation of legibility. We have also seen through various examples that good built environment can increase community spirit, that we can create intergenerational contact and also cherish long life experiences. We can also develop a sense of control, very much based on some of the earlier work of Abraham Maslow, who was talking about these different hierarchy of needs. But positive open spaces and places also provide us with access to food, local facilities, and provide other benefits. And they can also support walking, cycling, play, and other aspects. As planners and urban designers, we have tried to tackle this issue at all different levels of what we call morphological levels, from citywide, whether it's London or Manchester, Leeds, or other cities, down to individual houses, neighborhoods, and open spaces. So in defining what a healthy placemaking is, we can say that healthy placemaking promotes good quality design and quality places in order to develop sustainable, resilient communities, and also support mental well-being and promote good quality lifestyles. The history of being concerned about quality spaces and places goes to 19th century health acts that also produced a number of philanthropic settlements in order to improve quality of life. But as a landmark figure, Ebenezer Howard, with his work on garden cities, also helped us to understand how we can get benefit from both the country, the nature, but also all the other facilities that places can offer to us. Needless to say that the building of first garden cities of Letchworth and Welling garden cities was also promoting good health and positive lifestyles. And later on, some of the ideas also penetrated through the planning process into other cities, and particularly in the building of healthy new towns. We can also see that the current national planning policy framework addresses some of these issues, from promoting healthy and safe communities to well-designed places. Also very much connected are other policies that deal with transport, access to nature, enhancing natural environment, and overall achieving sustainable development. And we have seen that these national policies have been then translated into various local policies and have instigated the production of various design guidance and design coding principles. So over the years, we have acquired a wealth of information, but also political agenda that is currently being discussed, particularly in terms of the revisions to some of these policies through the new white paper. I would now like to outline some of the case studies that specifically deal with healthy planning agenda. So Healthy Utrecht in Netherlands is very much in the forefront of the current debate how as planners and urban designers we can create better places. Utrecht developed a vision, a strategy for a growing city to be all healthy planning agenda approach in order to develop places and spaces that would improve health, reduce pollution, different stresses, and make the users of the city walk, cycle, and enjoy different spaces. What is happening in their initiative is that they are turning grey infrastructure, roads and motorways, into green spaces and corridors, but also in doing that, they are engaging residents and citizens to say what they want to see in their city and how health and planning can be combined together. At the lower level, in particular neighborhoods, we can also see some very useful examples from Germany in Freiburg. Urban development is internationally known for its approach to low-car neighborhood based on ecologically sensitive urban design, access to facilities and uses, and instead of cars, Children can play, people can cycle, and there is overall impression that the healthier lifestyle is being promoted and also enjoyed. Closer to us in London, for example, but also other cities, we are seeing different policies being introduced and different tactical urbanism strategies, whereby streets are turned into car-free zones or traffic is reduced in order to promote walkability that also has a positive impact on general well-being of different residents. At the housing design level, we have also seen quite a lot of innovation. And in front of us, we have an award-winning development, Marmalade Lane in Cambridge, very much based on co-housing approach that was pioneered in Scandinavian countries, but here applied in a local context to benefit the residents in terms of reduced car usage, but also eco-friendly homes developed to high specification, but above all about intergenerational living and linking different age groups and sharing certain common facilities. But as outlined earlier in the introduction, when it comes to dealing with rundown areas of our cities, and today I will briefly talk about a scheme that I have been evaluating over the last few years, then the reduction of public open spaces in cities such as London, but also Birmingham, Manchester, and others, is very much linked to redevelopment, regeneration, and also investing into different kind of buildings and architecture. So looking at the example that I would like to talk about, which has turned around the negative experience of a housing system of housing estates in South Islington in EC1. In front of us, we have images taken in 2004 of rundown areas, tarmac areas around buildings, neglected open spaces, and generally depopulated in terms of presence of people because many of the areas felt unsafe. The approach that was taken on board by local authority planners in partnership with a skillful team of designers through local participation and the coordination of the public open space coordinator, a new strategy was developed, which was part of the New Deal for community funding and included the regeneration of houses and also included the opening up of the possibilities about what is known as a green chain by connecting streets, parks, estates, and overall improving the quality of the streets and open spaces. The health condition of the residents before the start of the program was recorded as being of high level of anxiety, poor physical activities. People were driving cars everywhere because the streets felt unsafe, and there was a general dissatisfaction with the overall quality of the spaces. So through the participatory exercises of engaging children, teenagers, and local residents, as well as the cross-disciplinary working of the local authority, but also other advisors and consultants, different parts of the state have been improved, whereby streets that were dominated by cars may be now traffic calmed, so that there is a better relationship between walking and cycling rather than everything being crowded by cars. What were rundown areas, tarmacked and neglected, are now green open spaces where children can play and use. The images are pre-pandemic images. And what is interesting is that I have been monitoring the responses from the residents. And even during the lockdown, these spaces were used for exercise and also for some social connections through social distancing. And the overall benefit has been recorded in many ways. In a pre-pandemic situation, there was also a revival of the street market. So White Cross Street Market was very much part of the whole healthy renovation agenda, whereby the grocers, the traders were all focusing on providing better quality food, and that helped the local economy, and also attracted socializing amongst the residents, because over the weekend they had various events, art festivals, and that brought them all together. In the survey we carried out, we identified a number of positive indicators. First of all, the majority of residents reported that they were more active, that they were able to walk, that they were able to cycle, and therefore they did not always rely on their cars. There was also quite a lot of activity linked to physical play by children, but also gardening. The second key quality was that with the improvement of public open spaces, people felt safer, they could walk more, and also they socialized more. In that case, they also created a more connected community where they felt that they could socialize and engage in different activities. Many reported that the area became more attractive, and therefore that lifted their spirit and had positive impact in terms of mental well-being and other benefits in terms of health. Healthy eating schedule was also very much implemented in order to see how we can improve our diet, and there were various sessions organized at St. Luke's Center in terms of learning how to cook healthily, and the reports are that children are performing better, were performing better pre-pandemic in terms of their learning experience. So this is an ongoing project, and the statistics are now being collected from GPs and by public health experts in terms of a longitudinal study to see how some of these interventions can also improve the general health of the residents. The second group of projects is connected very much to the Healthy New Towns program, and it was 10 demonstrator sites that made the bid to National Health England in order to get extra funding to combine the approaches of built environment production as well as healthy living. So they were scattered in different parts of the country, had different local circumstances, and also had different times of delivery in terms of planning, urban design, and other initiatives. So the key model was that built environment, community activation, and new models of healthcare had to be considered in the approaches of these new communities. They all varied in terms of their size. Some only have 3,500 new homes being built, while others go up to 15,000 new houses being developed. And some were rolled out to whole towns and cities in order to benefit from this particular exercise. Also, some of the teams are focused on healthy homes, and also for intergenerational living, and various local priorities in terms of health and well-being were being addressed to these projects. So I investigated and discussed with different teams different ideas that were put forward in terms of their work, and that was part of the process evaluation that I carried out over the period of time during the 2018. So it was still very much in the last part of the funding, but a program is continuing in all areas of development. So what comes as a common thread of ideas that arrived from different experiences is that various teams focused on their definition of what compact and connected urban form is. So they all had different size, different densities, but they all focused on the idea that they wanted to construct a place rather than just a number of houses that were being built in particular areas. They also focused on mixed use, access to good facilities, and some also employed healthy streets approach to design and development. Active travel was very much in the forefront of all of the programs. So developing spatially walking, cycling, and public transport infrastructure was very much important in order to get everybody active. And most teams did benchmark a survey of the health condition of different residents groups, and then through activation of different initiatives, they tried to measure what was the impact in terms of health benefits. The third key aspect was that they all focused on healthy food. So some had healthy cafes, food growing allotments, also orchards, forests, etc. Particularly important for children, but also for everybody else, was healthy play and leisure. So access to green and blue networks, multi-use of spaces, and also health in homes and buildings was very much important in terms of that development. Some also focused on developing master plans, healthy master plans that were also dementia friendly. So different tools were introduced available to the teams, from space syntax audits to understand the connectivity level, to a sense of investigation about place attachment and legibility, so mental mapping, but also using IT technology in terms of mapping how people use particular streets, particular spaces, and how also they can orientate themselves in particular neighborhoods. Health impact assessment tools were also used in terms of measuring how particular levels of activities can help in terms of various health benefits. And some of the sites also developed healthy design codes and incorporated their principles into local plans. So in front of us, we have an example of the design principle developed for Darlington in the County Durham. And that is a very interesting approach, which is based on green and healthy urban environment. And they had 3 demonstration sites that also now benefit the whole of the town, with a mixture of professionals from planning, urban design, health experts, politicians, and others. And what we can see is the integrative approach, very much based like the work of Projects for Public Space, whereby placemaking is part of different dimensions, from transport and mobility, social infrastructure, economy, green infrastructure, and various other benefits. This is now used throughout the town. Various other initiatives took place in among various case studies, from healthcare facilities and provision to particularly social activation. And there were also a number of school projects whereby engagement with children particularly helped to also reach out to difficult to target groups, particularly young teenage girls and also some of the women. So these different activation projects were also very much to almost develop like an urban acupuncture and intervention. Of particular interest to me was when I found out about the master plan developed for dementia-friendly urban environment. And this is White Hill and Borden master plan. And this is a new town which is being built on the land that used to belong to the army. And the master plan went through several stages of development and is coordinated by the Urban Place Lab, but also in partnership are various other development companies, politicians, health experts, GPs, and various other colleagues. What is particularly interesting here is how to connect the left new development with the existing development. The old town is full of cul-de-sacs, and therefore it was important to understand how people navigate. So the legibility audits were carried out to promote walking, cycling, and also to be more active, to also socially engage in different activities and benefit from that. So quite a lot of consultation took place through the development, working also with local artists to understand how color coding can be introduced in built environment, particularly in landmark buildings, so the legibility is enhanced and promoted throughout the development. They have also developed ideas about food growing and also came up with an integrated approach for a new town center as a result of these consultations. On the right-hand side, we can see Barking Riverside development, which was another of these larger new communities being developed in East London in partnership with various developers, and now very much part of QNL and also City Hall. And in their approach, what is significant is the understanding of the landscape and the needs to heal the landscape. They develop almost a biophilic design in terms of improving particular qualities. So 40% of the development is rehabilitated land from the former power station, with different housing typologies being introduced to cater for intergenerational living, and different initiatives with particularly public health experts. We're promoting social activation, green gym, and also thinking about recycling of water and various other eco-friendly design elements. And this particular project is attracting quite a lot of attention in terms of its value. One of the largest developments, Ebbsfleet Garden City, which is in Kent and along estuary, is also very significant. And they have produced a number of new innovative approaches, from planning to urban design, but also in terms of connecting to elderly people living in the community, and connecting both the existing communities and also new developments. So in front of us, we have a wayfinding map, which was used in order to understand how people can navigate, how they can walk, which areas can be improved, and how everybody can benefit from such development. They are planning to build 15,500 houses and create also 33,000 jobs. They also organized a landscape competition through both the National Health England and also Landscape Institute, and quite a lot of planning input was provided through the Development Corporation, inviting everybody who was interested in creating ideas for green city, for green areas of development, promoting exercise, and also benefiting from new housing typologies and ideas. So they engaged in understanding the aspects of green element in the landscape, and how urban and rural can be combined together. So the connectivity between different corridors was very important in terms of that development. And also they were trying to improve the legibility of the area and make it more dementia friendly. And for that they used different apps and tried to coordinate different forms of interpretation. They also worked with healthy housing designs and long-term and lifelong housing, and also focused on healthy eating and trying to integrate socially different types of communities. A very interesting example is the case of Ecotown Bista, Healthy New Town, which started as a small scheme of about 250 planned houses, but then later on has been rolled out into the whole town, which is one of the fastest growing towns in the region, very much linked to the growth of new industry and various other benefits. But the lessons that are currently being analyzed from different initiatives here are going to feed into the building and planning of new housing developments and settlements linking Oxford and Cambridge, and therefore it's significant in terms of that knowledge. Various health surveys were also carried out and put back into the analysis in order to understand how over time planning, urban design, and healthy activities can also improve our quality of experience. So key findings have been published in Putting Health into Place publication, and you can read more about it if you haven't come across this particular set of publications, which was published by NHS England, but also various other partners. And subsequently, during the summer, we have seen the publication of Building for a Healthy Life, whereby updated version of Building for life scheme was very much updated by a team of experts, planners and urban designers to understand how we can design integrated neighborhoods where we can benefit from different types of development. So we are not creating gated communities, but we are connecting different neighborhoods. Also distinctive places that we all focus about, that we don't want to replicate and create places that all look the same, and also how we can affiliate with such developments. And above all, also their publication included Streets for All. So again, a manual and toolkit for designing that can be used by different experts. So why do healthy places matter? There is so much research coming from academia on that and books published. And I will just briefly summarize some of the key drivers of that. First of all, they promote qualities of place identity. And we heard earlier in terms of how we need to enhance the experience that we have of our cities, neighborhoods and streets, and therefore create unique places that will also provide a strong sense of attachment and support. We also can build strong and more diverse communities. So socio-dynamic of the particular areas is very important, understanding the social structure of our residents and also how communities can come together. And very much linked to that is also a sense of place attachment that also links to place identity, and also how we can promote healthy and safe environments that can also promote healthy living and safety in our towns and cities. There have been also various publications and research carried out in terms of the place value from economic, social, and health and well-being issues, very much linking also to whole sustainability agenda. And there is so much information about it that good place also has good value. And so social value, environmental, economic, and health value. And therefore, if we can connect the all the aspects together, we are likely to be producing better quality places for all of us. It is also important to promote links with man-made and natural environments, and we have seen the linkages before in terms of green and open space strategy. And in this particular approach, I think we also need to consider all this holistically, so that places have many dimensions in terms of their qualities. There is quite a lot of debate now. What do we do with both the current situation during pandemic, but also post-pandemic interventions? Through our observations of cities, neighborhoods, etc., we have come to realize which places work better. And there was also a very useful report published by the Place Alliance Group that talked about different kind of morphologies, different kind of topology of buildings. And one of the key aspects was that different housing types and neighborhoods have been seen by different users in both negative and positive sense. So the absence of green open spaces, high density living, and living in high-rise developments was seen as less successful than perhaps traditional terrace houses, medium rise apartments, etc. And access to green for exercise and various other facilities was very important. We also saw redesignation of streets and roads to promote walking and cycling, and the pop-up groceries that came into our neighborhoods as a result of ability to sell produce at certain periods of time, and that also stimulated in some areas local economy. So through the various workshops that I have participated in during the summer, I'm going to summarize some of the propositions that came from planners, urban designers, and others very much concerned about quality of places, but also health in a built environment. So one recommendation is to review the compact city models and densities. If we look at the government agenda to increase densities, the view is that these densities need to be considered in terms of also qualities on the ground, not just number of housing and apartment dwellings, but we need to understand the configuration of particular layouts and forms of cities rather than just numbers. Very important is to promote green-blue corridors and biophilic design. Again, mental and other aspects of well-being are very closely linked to our access to green and blue corridors, and therefore looking also from the lessons of Healthy New Towns, this is something that we collectively can review and improve in our cities and neighborhoods. Reduce car-dominated movement. Some have suggested 20 miles per hour movement in all areas, and we have seen also funding coming from the government on low traffic neighborhoods, but the implementation of these needs to be assessed, because we don't want to create some clean streets and in other parts we create even bigger trouble in terms of pollution and other hazards. We need to turn roads into streets, create wide pavements, cycle tracks, promote connected, walkable and cyclable neighborhoods. Again, going back to these connected neighborhoods. Review the role of open spaces and local parks. Quite often, as we saw earlier, they can be neglected and without due care, but we need now to revive them, because they certainly have a lot of benefit for health, but also general social well-being. There is also quite a lot of discussion about promoting a 15-minute city, an idea coming from Paris and very much debated here in terms of that we can walk and cycle to our amenities, schools and various other facilities rather than drive everywhere in the car. But above all, I think it is also about good quality housing design that can promote internal space organization, and the working from home, particularly during this period, has been very important to understand whether our internal standards are right and whether perhaps we need to think about how we design housing for the future, and also to think about different typology we saw from co-housing schemes and various other developments that are age-friendly but also climatically responsive designs need to be incorporated in our thinking. So here we have pre-pandemic and during pandemic cycling in London, whereby again thinking more strategically about our cities, how we can integrate across the wider scale of development different patterns of movement that are based on exercise and also benefit in terms of other reduction in pollution. So to come to propose now some key principles, I think we need to think about how we structure green-blue networks, how we can have access to quality spaces and healthy play and leisure for all groups of our society. How we promote better urban climatic control, and again with the densification of some of the developments, particularly in London, we also need to understand how microclimate is performing, both in terms of increased temperature, but also lack of circulation of good air or wind blowing in some of the areas. We need to think about air quality and also inspire and enable healthy eating and also various other benefits. But above all, we also need to think about integrated public transport, walking and cycling, and streets that are safe and can promote surveillance and also encourage us to use spaces and places in a much more active way. So again, just to remind us in terms of these principles, very much based on 5, 10 and also 15-minute cities walking distances and neighborhoods that can promote street markets. And the Project for Public Space has been running various seminars about market cities and how health in streets and areas and neighborhoods that had markets also benefited during pandemics. But we also need to foster health in homes and buildings and promote social activation. The evaluation of various schemes that we have around us is also very important, and we can learn lessons from, as we saw from London, also lessons from the urban growth strategic developments in East London. Cities such as Oxford, where new measures are being introduced to promote walking and cycling and clean the air with zero emission targets for 2030. And learning also from already existing communities, whether they were newly built like Poundbury or pockets of open spaces and streets that we find in different cities. So the final remarks are that a multidisciplinary, better together approach is needed, and that we also need strong leadership development, which comes from both the professional experts but also politicians, and that we need to learn how to work more closely across different professions. And that also includes developers and others in terms of how they can also learn from us in terms of new principles. We have also learned from different examples that there is an added value if we focus on developments that are focusing on urban acupuncture via special initiatives and projects. So some initiatives in Nottingham in pre-pandemic period looked at transformation of public open spaces and how we can turn them into beaches or play areas. And they can test some of our ideas before we commit ourselves to a lot of investment or development. But there is also quite a need to engage with wider community, with schools, community groups and volunteering groups. Again, during pandemic, we have seen how volunteers have been absolutely critical in terms of supporting aging residents who couldn't go out, who were shielding, and connections with schools and universities was also very much important. But I think legacy that we have inherited from different approaches are developed over time, and a long history of planners being in the forefront of thinking about strategic issues of creating places that are loved, that are healthy and also sustainable, can lead us into healthy and sustainable placemaking for all ages. Thank you.
That was fantastic, Georgia. Thank you so much. That was just so incredibly interesting. My mind is just buzzing with all the things that you talked about. And I was really pleased that you mentioned Marmalade Lane, which was the winner of our Silver Jubilee Cup 2020. And anyone who hasn't seen the Marmalade scheme or who wants to know more about it, it was a subject of a presidential visit last month, a virtual one. So it's actually recorded on the RTPI YouTube, and it really is worth looking at if you have a chance. Just very quickly, as you might expect, we're actually approaching almost 500 people in the audience. So we have had an awful lot of questions that have come in. A couple of the questions are about the slides and about whether we'd be sharing them. The answer is yes, we will be. And it's also worth just knowing that the session we're in now, this Nathaniel Lichfield lecture, will be recorded or is being recorded, and it'll be on the RTPI YouTube channel. So please spread the word to anyone who would like to watch that. And finally, one very quick question we had was about dementia and dementia-friendly planning and how that, any tips for local plan policies. And I just want to point people to an RTPI publication which came out in September, which is about dementia and planning, and again, very well worth looking at. So I've been trying to read through these incredible number of questions, and what I'm going to try and do is sort of pull together some of the themes that have come out of them, because there are some consistent themes. So if I can pose the first one to you, Georgia, it's how do we consolidate and implement healthy placemaking principles?
I think there is really no shortage of publications, ideas and knowledge, and I think credit goes particularly to the Royal Town Planning Institute colleagues and also commissioned research and others. And we have seen a number of publications on design guidance, but also living with beauty publication, and as we saw, put health into places, etc. But it's still very fragmented. And I think there is a lot of knowledge focusing on these individual ideas. So it would be useful, and I can recommend that perhaps our academic partners can help with the RTPI consolidation of that information to see how we can digest the common principles further and see how we can further implement through different local policies, but also various other initiatives, and promote healthy place agenda. So I think there is a lot around us. It's really digesting, because I can just imagine a very busy practicing planner not having enough time to read something like 10, 15 different publications. So it could be that a digest of some of it is also very much produced. But I also think there is quite a lot of other knowledge in books, in papers being published about healthy planning and how planners can engage with a healthy agenda, which is important. But I think where particularly we are lacking is in public health partners helping us with data collection and interpretation. And we know that as planners, we need to understand socio-demographic composition of neighborhoods, cities, etc. So it is also that we work more closely together in terms of both the design of surveys and also digesting some of the key principles and monitoring longitudinally in terms of how health can improve in particular neighborhoods, particularly those that you mentioned earlier, run down or high density living, because without that, we are only having assumptions but not clear evidence that it can be improved. So I think there is a period for consolidating this. I also understand that as a result of the consultation on the Building Our Future Cities white paper, is that health was not perhaps equally represented in some of the questions that were asked. So I understand that the new chief planner and others are looking into specifics of linking sustainable and healthy city and design quality agenda.
Thank you. That's really nice to know that that's being taken forward. Right, the next question, again, what I'm trying to do is sort of wrap up lots of themes that have come through from the questions that have been posed. So the next sort of theme that's come through is really asking about who are the key actors and what skills and resources do we need to take forward healthy placemaking principles?
I think it's more or less everybody in the professional built environment and natural environment professions. So linking planning, urban design, architecture, but also landscape design, public health workers and others is important, that we all talk from the same platform. And I think where there is still a lack of knowledge, more than perhaps between practicing planning professionals, is amongst developers, because I'm still hearing and seeing developments that are based on old-fashioned housing typology model, or on the other hand, very high density apartment living that we know has implications in terms of safety, but also various other issues. So I think everybody really needs to have the skills, and it's a huge task, because if we think about you know, what is required of a young planner to learn through academia, all the different aspects of planning, from strategic planning to different levels of policy, etc. The knowledge is enormous. And also, if we are going to be dealing with more issues of design and placemaking, and then the shortage of skills in design methods is equally important. But I think most of the academic providers are now very much focusing on connecting healthy agenda and sustainable agenda. But I also think that the Institute has a huge role to play in leadership, in organizing events for debates and discussions, through the award scheme, in terms of awarding schemes that perhaps have innovative approaches, and the high profile events and training. And therefore, I think I have heard that there is a proposition in terms of how much money will be needed in order for all of us to get updated knowledge, and through CPD and other training. So I'm not going to give the figure, but perhaps that can be discussed later on. But it is important, and I know how through our training and also CPD organized by RTPI, it is very important that we develop these skills.
That's a wonderful lead into RTPI training and things, all the things that we do as professionals. Now, very conscious of the time, so I just want to ask one last question, which again relates to a theme that's come through, and the theme is climate change. And the question is, do you think climate change will change what healthy places look like, or the interventions required, or do you consider the interventions and principles that you've outlined already as complementary to that?
I think that climate change is underlying all of it, because climate change will have impact on biodiversity, our natural systems, also increased temperatures in environments, but also homes. And I think we have seen some examples of creative eco-friendly design, both in terms of environmental considerations, but also in terms of housing design. They all need to be environmentally responsive and take on board climate change. And I think there is quite a lot of research carried out, particularly in North America, about the relationship between climate change and mental health, and also heart diseases and various other factors. So I think we need to be very much up to speed in terms of how to deal with it locally, because our local incentives and measures are also likely to affect us globally. And I think there is quite a strong movement in terms of particularly practicing and academic planners and urban designers to think more strategically. And this is where I think different models of developing cities should not only be based on the economic value. Equally, the value of the place is our own life sort of support, and therefore our mental, physical and other aspects of our health need to be considered in partnership with the decisions we make about climate change.
Well, thank you so much, Georgia, and thank you to everybody who's tuned in to this really very, very special 10th Nathaniel Lichfield Annual Lecture. Georgia, it was a wonderful theme and a wonderful presentation. And my apologies to all those who put in the questions, and I hope I've captured the main themes from them. I'd love to have been able to have posed all of them, but I think we'd probably still be here tomorrow to get through them all. So thank you once again. Thank you to everyone who's listened. And just a reminder that the recording of this session will be up on the RTPI YouTube website, hopefully tomorrow. And we look forward to seeing you all again next year at the 11th Nathaniel Lichfield Annual Lecture. Thank you so much and have a lovely evening, everyone.
Thank you.
Thank you, Georgia.